when someone is very chronically ill and has neurological symptoms, gastro symptoms, chronic pain, those really, really sick people, which I was one of them, is you have to look at the mast cells that are firing because there was an insult to the body, whether it was Lyme or mold or metals or maybe a traumatic event to the nervous system. And so you have to look at that. You have to stabilize because it calms down the system.
What if I told you that the same mindset that builds championship teams also builds an extraordinary life? The same discipline that drives elite performance to greatness is the discipline that unlocks a longer, stronger, and more resilient future. This is where peak health meets peak performance, where we explore the science of longevity and the mindset of greatness. Because your legacy isn't just what you leave behind, it's what you show up with every single day. This is the Legacy and Longevity Podcast. I'm Zach Dancel, your host. Welcome back to the Legacy and Longevity Podcast. Today's conversation is one that I've been super excited about because it sits right at the intersection of frontline medicine and where healthcare is clearly heading. My guest today, Cheyanne Welton, also known as the Biohacking Nurse. She is a registered nurse who didn't just arrive at functional medicine, through trend or what she saw on Instagram. She got here because she actually went through an experience and had the frustrations and had the pain in a true lived experience, right? So just the years of unresolved symptoms and the dead ends that she faced, she battled through that and is doing her own thing, right? She's still a nurse on the front lines, but really taking the forefront of, functional medicine, peptide therapy, the future of where we really see healthcare going. So Cheyanne, welcome to the show.
Thank you, Zach, for having me.
Oh, of course. I love starting at the very beginning to obviously help listeners and viewers get to know you a little bit, really understand your origin story. So I'd like to start there, where every clinician starts, right? Where you have this belief, you go into school, becoming a nurse, wanting to do, great things in the system, but then obviously you were in the system and you saw how it works and you saw the gaps. So talk to us a little bit of just, what laid that foundation and where it all started for you.
So actually it started at a young age. I grew up a very sick child. I was chronically fatigued. I couldn't recover like other children. And I just really struggled. And I was passed around from doctor to doctor in the allopathic setting. And at one point, even my white blood cells were so off, they were like, I think you have cancer. So they sent me to an oncologist. Well, I never had answers. And that's why I decided to become a nurse, actually, because I wanted to get into healthcare myself and figure out my problems. So I actually didn't become diagnosed with what was the cause was Lyme disease until I was 22. I was actually done with nursing school. I made it through. I don't know how. I was very, very ill. And I actually had a dream that I had Lyme disease. And I was visiting my brother in Los Angeles. And in Idaho, where I live, there was no specialist. So in Los Angeles, I Googled the nearest Lyme disease physician. And you have to get specialized testing that insurance doesn't cover. And I went to him and I said, I think I have Lyme disease. And he ran my panels and he said I had outrageous numbers and I had several infections. And he did say, you have Lyme disease and we need to start antibiotics IV today. And there was something within me because I was a nurse that I was like, I just don't know if my body can handle IV antibiotics. Like something just doesn't feel right about this. And I walked out of the clinic and I asked people in the waiting room, do you feel better from your treatment? And they said no. And so I said, I'm going to start a journey from here. I know it's going to be a long one. And so what I did from there is I started really getting into biohacking, how to change your environment. What can you do that doesn't involve a physician? Because I didn't really have a great one until later in my journey. And I really learned about detoxification, circadian rhythms. I studied, just how to eat well, how to balance your blood sugars. And I tried to just put it all together so I could feel better myself. And that's why I started my Instagram, because in the beginning, you can see I would post how sick I was. And now I'm posting, what I'm learning, what I'm discovering, how I've worked with other people, their testimonials. I like to bring it all to the surface and let people kind of guide their own journey, but see what's working.
I think that's obviously it's horrible that you had to go through that experience, but one thing that I think like RFK Jr. and the system is really putting out there, right? I think they just came out, they posted something a week or two ago about really pushing for more education and information about Lyme disease, right? Because um, people don't really understand uh, just how significant it is and how relevant it is. The problem is that no medical providers are really trained to spot and diagnose and understand when they should do this testing, right? Because obviously the system isn't going to cover it. The Western blot it has like a 50% false negative, false positive results. So it's like it's really hit or miss there. You obviously you can do the Horowitz to kind of get a gauge based off of symptomology, and use that Western blot as kind of as a gauge. But ultimately, if you score above, I think it's like 40 on the Horowitz score, right? That's when you really need to get an advanced functional Lyme and co-infection test, right, to truly understand the different strands that you might have. And obviously, that's also going to give you that proper personalized treatment protocol, right? Because based off of the different kinds of Lyme or co-infections that you might have, comes with a different protocol, right? Obviously, there's a lot of detox involved and really revamping your environment. But again, I think it's a shame just how little people truly know about Lyme disease and the fact that it is so relevant. We're really doing people a disservice because of just how impactful. I mean, it's a nasty disease. My mom, she has had Lyme disease, um, but it's a gnarly disease. It's considered a great imitator, right? You have Lyme disease, but it hides itself from what it really is, and presents as other issues throughout the body, depression, fatigue, whatever it is. And so when you go to your primary care, like they're that's what they're thinking. Oh, like she has depression. Let me depression. Let me prescribe her an SSRI, something like that. So, um, talk to us a little bit more about, okay, like when you were finally diagnosed that, what were some of the big things that really helped you, um, recover from that?
Yeah, so I left nursing in 2019 to work more with supplement companies and detoxification companies as a consultant. And what I figured out was how much environmental toxins like mold can, really mess with the immune system. And then Lyme can actually play a much bigger role when you have mold or heavy metals. And so what I did was I really worked on my drainage pathways. So I was really like, working on um, sauna therapy and coffee enemas and how to like open up the drainage so that you didn't feel as ill, because walking around with Lyme disease is kind of like walking around with the flu all the time. You just always feel terrible. And it's all of these biotoxins that are accumulating in the body and they don't know where to go. And so if you can help the drainage first, that's a great step. The other step that I learned much later on my journey when I got a really bad bout of COVID was the mast cell function and the inflammation piece. So if I were to go back, I would definitely focus on the mast cells first. And one person can have Lyme disease and have minimal symptoms. The next person can have Lyme disease and have really bad symptoms, right, on their test. So you kind of have to look at the person and look more closely what's going on. And when someone is very chronically ill and has neurological symptoms, gastro symptoms, chronic pain, those really, really sick people, which I was one of them, is you have to look at the mast cells that are firing because there was an insult to the body, whether it was Lyme or mold or metals or maybe a traumatic event to the nervous system. And so you have to look at that. You have to stabilize because it calms down the system. So you actually have less inflammation and then you can go through your treatments. A lot of people cannot go through treatments. They can't, do herbals anymore. They're too sensitive. They can barely tolerate supplements. So going back to that first steps is you want to stabilize mast cells with your physician. It definitely takes a physician, in my opinion, on this level when you're this ill. Next, you want to really look at your terrain. So like I said, mold, you want to make sure you're not living in a moldy environment. So when I was, it was after I was diagnosed, I had moved, I really loved design. So I wanted to move into this older home that was so cute and so charming. And I got sicker and sicker. I started getting like chest pain and these like crazy symptoms. And I left for a weekend and I felt better. And I was at a conference talking about mold toxicity. And I was like, you know what? I think I'm living in a moldy home. Like it's 100 years old. Like it has to be moldy. And so I go home and I open one of the cupboards that I never opened in the basement. And there was just mold growing on cement. And so I knew then that that was going to be like a piece of my journey. And I'd already had Lyme. I had mold. And then I ended up getting COVID later on. But this is just part of, when you're a sensitive person and you have some genetics you have to work with, these different insults, you just have to kind of approach them all the same. Are you opening your drainage? Are you using binders, chelators, whatever you need for the molds and the heavy metals? And then are you making sure your drainage pathways, like your bile is very important. So liver health, toxins come out of the bile. So I love castor oil packs. They're great for self-care and inflammation. And then you can work on the next part. Usually parasites are always a problem with people when they've been immunocompromised forever. So doing like a parasite cleanse can really help people clean up their terrain. So you've already worked with the mold, the parasites, the drainage, and the inflammation, and you're already a different person. You might have the bacteria left in the body and the testing, but you can get much better and be functioning before you even address the Lyme disease, which is usually last. Because it's such a stealth bacteria, you've got to really work on the terrain before you get there because it hides in biofilms and it's very hard for the immune system to detect.
So you had mold, was this all at the same time with your Lyme disease as well?
No, it was a journey. So I had Lyme and then I was working on that. And then I moved into a moldy home once I had felt better because I was like, oh, I want to move into a really cute home. Didn't know about mold. And I was a working nurse at that time. And then I was working on call and it was like very stressful plus the mold. And I was like, I just can't do this to myself. And so I left nursing and I went into sales and consulting. And then I moved out of that house. I detoxed. I started feeling so much better. I ended up being like symptom free and really loving my life. And then a few years later, I ended up getting the first round of COVID, which can cause very big issues. I think as functional medicine is evolving, we're trying to solve this puzzle of spike protein, whether you got a vaccination or you didn't, and you got sick because it causes a very inflammatory cascade in an autoimmune client. And then also that mast cell component. So that's why I learned about mast cells after COVID because I got mast cell activation syndrome.
Yeah, and just kind of help people understand what mast cell is, right? They're immune cells that live in your gut, your skin, lungs, near blood vessels and nerves, and their job is to detect threats and trigger defense. And so, it seems like you were going through the gauntlet, right? You had to deal with Lyme, you battled through that. You had to battle through mold, then COVID, and the mast cell activation. What were some of the most powerful treatments that you saw or that you used and truly implemented that made the biggest difference?
So before I knew about like compounded medications that could help with mast cell, I actually did a carnivore diet for 90 days and that was very effective. It's like the ultimate elimination diet, and I don't recommend it long term, but that was like my first experience with like symptom relief. And that's because you're not eating lectins, nightshades. It's like the ultimate autoimmune reset. So I went through that, and then I got quite a bit better. And then I started seeing physicians who were into compounded medications. So some of the ones I love are LDN, which can really help autoimmunity, but also MCAS. And then a compound called Lexinox. It's actually used in the med spa industry for insulin sensitivity and weight loss, but it's actually an amazing mast cell. It reminds me of taking a ibuprofen that's healthy. Like that's the benefits you feel from it, and I love that one. And then there's other ones, if you're very severe, especially in the gut, if you have a lot of SIBO or gastroparesis caused by MCAS, cromolyn, sodium is great. And then if you have more of a chronic pain picture or just like a really nervous, I feel like if it really affects you in the nervous system, ketotifen can be a great one as well. And you can actually take all of them. But one thing that got me more into peptides than I had already been into was I heard one of my mentors, Dr. Christine Schaffner. She's an amazing physician. She was trained by Dr. Klinghardt and is very, biologically trained. She thinks about every system of the body. And she was giving a lecture, and she said, I use low-dose GLP-1s in my chronic illness patients. And I thought GLP-1s didn't apply to me because I didn't want to lose weight. I actually needed to gain weight. I felt so undernourished when I had MCAS because, in the gut, when the gut's super inflamed, like you're not going to be absorbing nutrients. You're just like passing it through probably. And so I ended up taking a low-dose GLP-1. I have access to compounded medications, and the inflammation just like silenced. And I was like, wait, this is crazy. And I've also got some hypermobility stuff from the MCAS, and I started working out again. I started going to Pilates. I wasn't as sore, and I started using GLP-1s in my autoimmune audience, and they were scared at first, but they're like, Cheyanne, I know you've been through this journey, so if you're going to do it, I'm going to try it. And I've had so many customers with mold, Lyme, MCAS be like, in all of my journey, GLP-1s helped me the most. They've hundreds of thousands of dollars, and this, and you hear these horrible things. Well, I always have to sometimes educate and say, originally using this compound for diabetics, and when it first came out, they're going to use large doses, and they're starting at large doses thinking they're going to treat the diabetic. And the diabetic already has a lot of comorbidities. They have a lot of organ damage already, and they're giving these high doses. And I'm like, that's not the experience that you should have on a GLP-1. You should start really, really low and in a microdose fashion and see, can you be at the lowest dose with the most possible benefits while living a healthy lifestyle, right? You can't just ride a peptide train and expect your life to be perfect. You're still going to want to eat a protein forward diet for balanced blood sugar, get in your fiber if you don't have really bad like SIBO issues. You want to master your circadian rhythms, but adding that GLP-1 in can be like life-changing. And some of my customers can eat foods again. When you have MCAS, I call MCAS like basically a food intolerance queen. Like you're allergic to your environment, you're allergic to chemicals, you don't tolerate anything. And so people are eating gluten and dairy again. It's so cool to see like these benefits and get rid of the bad reputation that GLP-1s have. Even my mom, who autoimmune kind of runs in our family, she's thriving on a GLP-1, like thriving. She used to be always sitting on her couch after work because she was so sore and tired. And now she's doing all the things after work, and she works a very physically demanding job.
Yeah, no, I think To your point, right? GLPs, GIPs are they there's two sides, right? Some people are for them, some people are super against them, right? And I think it's somewhere in between, right? How it's used, right? When done used properly, done the right way. Um, to your point, these the system, right, is pushing super high doses, right? Because that's where the pharma economics live. Yeah, the more that you're using, the bigger the consumption. That obviously generates more financial profits and stability for the drug. But it's far more than just what's on the scale, right? To your point, yes, it does a great job at helping people lose weight, but it does so much more than that, right? I mean, it helps with cardiovascular protection, right? It can help with liver health and fat metabolism. It can help with neuroprotection. I mean, there's just so much more studies and benefits that are coming out, that it's such a bigger and more powerful drug than people, tag it to be than just this weight loss drug. Now, I'm not saying everybody should be on it, right? It's for the right person at the right time, utilized the proper way, um, and managed properly, right? I think it's kind of scary to see that there's some places that are just offering without you ever even like working or seeing a provider, right? Because they see it as like a quick buck to make. Um, but I think that's kind of like where things kind of get lost and can be dangerous. Like if you're not working with a professional who's who knows how to properly use this drug and how to titrate you and how to microdose based off of you, because everyone's not going to need the same dose, right? I
Absolutely.
would need a different dose than you. I'm obviously I'm bigger than you. I'm might have different activity level than you. We just have different biology that if you're on at the end of the day, medicine is medicine, right? This is medicine, right? You got to make sure that you're still doing it the right and safe way, and that's kind of where like working a professional, providers, whether it's practitioners, nutritionists, people like yourself who nurses who have the experience, who have the education, right? At the end of the day, you just got to be working with someone who has the expertise and experience, that I think kind of um, is the main message to get out there, that these are great drugs, right? I think they can do wonders for the population that 95% of the US is metabolically unhealthy, right? So there has to be something done at scale, and I think these drugs can be a part of the solution, right? This isn't a lifelong thing, but it can be a part of the solution. It can also help with other things along the way while we're correcting, the years of just mismanagement of metabolic health that we have today.
Right. And I always encourage people go get a set of labs before you start your peptides. Like get your fasting insulin, which your primary doctor is not going to run. You need to know your fasting insulin. You need to know your A1C, your fasting blood glucose. Those are going to be altered by a GLP-1. And then you also want to look at your CRP, your SED rate, which is, I've seen those improve on a GLP, which is your inflammatory markers. And then I've also seen homocysteine improve, which is risk for cardiac events and strokes. I've seen people who have methylation issues who can never get their homocysteine in check, and it's finally in check on a GLP-1. So yeah, there is cardiovascular benefits. I feel like it's so beneficial at a low dose for people who are have a family history of cardio events to be on. It's something to consider. I feel like it's a longevity molecule at this point. I mean, I do feel like the people who are on the right dose of a GLP and maybe feel their peptides, they do have an unfair advantage and they're just getting a lot more out of life.
Yeah. So how would you say, because I know you talk a lot about nervous system regulation. How would you say when you were dealing with mold, Lyme, and mast cell, and even COVID, how did stress and emotional load affect your symptoms? Once your immune system was already, compromised.
This is huge because I don't know if it's the chicken or the egg. I don't know if the histamines set off the nervous system and then you have emotional dysregulation or a traumatic event can happen. But I do feel like both can happen and then alter the other. And I was just having a conversation the other day is how can you regulate your nervous system? But if your brain is on fire from these neuroinflammatory issues we've been talking about, it's going to be really hard to get any good results in therapy or with your, if you do like vagus nerve stimulation tools or whatever you're going to use. You have to calm down the mast cells, in my opinion, because they literally, I believe, cause the brain to be on fire. That's how I personally felt. And it was such an uncomfortable time in my life. And it was the darkest, scariest time of my life when your nervous system is out of control and your thoughts are dark and you just can't live a normal life. You have brain fog. And I'm super passionate about mental health as well. And I do feel like this is I actually heard a podcast the other day. We can link it in the show notes, but a psychiatrist, one of the leading integrative psychiatrists in the country, is actually treating people with mast cell stabilizers, and they're getting off of mood stabilizers and other serious psychiatric meds. She is one of the, for me, like the most forward thinking when it comes to that, because she's really looking at physiological reasons why a person is ill. And she's there is a time and place for medications though, and so she will use those medications, especially if someone's really in a bad state. But then she'll utilize some of the compounded drugs I've talked about for mast cells to stabilize a person, and that person has never experienced proper emotions until their mast cells were stabilized.
Before we continue, I want to share something deeply personal, the real reason my family started Nava Health. Over a decade ago, my mom was on her deathbed. Her organs were failing, and the doctors told us there was nothing they could do except keep her comfortable. In that moment, everything changed. We realized traditional medicine had limits, especially when it came to proactive and preventative root cause medicine built for long term health span and lifespan. At Nava Health, we take a data driven precision approach to longevity. We test over 90 biomarkers to uncover exactly what's happening inside your body, and we build a personalized plan designed around your unique biology. Because fatigue, brain fog, weight gain, they're not random, they're signals. And when you listen, your body can heal. This is functional longevity medicine done right, comprehensive, proactive, and built to help you feel and perform your best at any age. Go to navacenter.com and take control of your health today. Now back to the show. We see a lot of those clients on a day to day at Nava, and the same similar feeling, right? Their brains on fire. We hear that a lot, and to your point, I think mental health is obviously it's a huge epidemic as well, but I also think it's probably one of like the biggest misunderstood um, of a lot of the health industries, right? Just like kind of functional medicine was considered woo woo, but now it's really becoming much more mainstream. I think there's so much misunderstood on the mental health aspect, to your point, right? Where the traditional treatments are, again, they're treating symptoms that were diagnosed based off of symptomology, right? Based off of a questionnaire, right? Like there's no true way to diagnose a lot of these uh, mental health issues, right? Like there's no test that can show us. It's questionnaires, it's symptoms, and it's kind of like a guessing game. To where your point, right? The integrative doctor that you worked with, where she started using GLPs for mast cell, and then was able to get them off the mood stabilizers. It's just that's some of like the powerful things, right? Where we're going back to where metabolic health, mitochondrial health plays such a factor um, in mental health overall, right? Where a lot of people are being treated for mental health as like an actual, like the actual cause in the disease, versus like, let's go back to functional medicine, functional biohacking, longevity medicine, whatever you want to call it. All it really is personalized root cause medicine,
Yeah.
right? Treating the root cause of a disease or symptom or diagnosis, right? So um I think, and there's plenty of functional medicine, longevity, and biohackers that talk about it a lot, that a lot of the mental health diseases that we hear or talk about today aren't truly mental health, diseases, right? They're uh, gut dysfunction, right? Mitochondrial dysfunction, uh, mast cell, right? Like just different things that are playing a part. But for a lot of the traditional medicine doctors in the system, it's super easy because for them to just slap a mental health diagnosis on it because it's easier for them, right? It's that, oh, you have depression or low mood, you have low fatigue, let me put you on this SSRI. And I think, that's one of the big things I think, in hopefully in 2026, especially, I think 2026 is going to be year of the peptides. I think it's a huge movement that we're seeing that's going to be, transformative for functional longevity medicine, anti-aging medicine. So I'd like to kind of shift to that, right? So I know you're super big into peptides. I'd love for you to kind of talk to us a little bit more about the peptides that you're using and that you like to use, and some of like the clinical applications that you see out there.
Awesome. So we'll start with the GLP-1, GIP, which is otherwise known as tirzepatide. I don't really work with semaglutide. I feel like a lot of people lose too much muscle mass, and they have more side effects that they complain about. And with the tirzepatide, I feel like there's more balance on the insulin sensitivity aspect. So PCOS, perimenopausal clients who are going through insulin and blood sugar issues, they really thrive on the GLPs. And then they can finally lose the weight too that they've wanted to lose that just won't budge. They've worked with their thyroid doctors, they still can't budge it. Um, so I really like the GLPs for just even trying to cycle them, even if you don't have maybe the indications for them, you could try a really low dose and see how it just affects inflammation. And you can kind of get more sculpted if you're going for more of like a vein aspect of like wanting the body you've always wanted. Just a low dose can help. And I really love, when you really want to clean up your diet, and you have really bad cravings, it can really help you with a more protein focused lifestyle. So the GLP GIP is definitely one of my favorites for myself and for others. And then my next one is probably a blend of because pharmacies like to blend it together and I feel like you get better benefits, but it's the BPC 157 with the TB 500. A lot of people have gut health issues, they've got gut inflammation. They've also just got systemic inflammation. They've got probably old injuries that they need to heal, or they just want to recover better in the gym. So you've got some gut brain axis benefits there. You've got recovery. I use it personally for, like I said, the hypermobility and connective tissue stuff that runs in my family.
No, that the BPC 157 TB 500, what a lot of people call the Wolverine stack. Um, I've used plenty of times. Sadly, just 'cause me injuring myself, whether I'm working out or playing sports, and just the rate in recovery that I've seen, because my background is not sure if I told you, but I played college ball or played football my whole life, and got to play at the higher level, the collegiate level at University of Maryland, Wake Forest. And so I was used to. I never had to get any actual surgeries, but I was used to sprains, micro tears. So I understood how long some of those take and how nagging. But then when I got out of football and I got introduced to BPC 157, um, just the speed in which I was able to recover on similar injuries that might have taken me months was reduced in half. So I mean, it's without a doubt, like, yes, GLPs, GIPs are great for a lot of people. BPC, the impact that it has on someone like myself, because I don't necessarily need a GLP or GIP, but BPC, I keep a stash at home for me. Like the second something happens, or I'll cycle on to help with with, to your point, some gut repair, gut lining, gut health. But definitely there for if I ever injure myself, just because it was. I mean, it's like a magic pill, right? People are looking for a magic pill. Well, BPC might be the closest thing to it.
That one really hits home for you, I can tell.
Yeah.
Yeah. Well, if you want to stack on the Wolverine, if you add in the GHK copper, then you get the glow blend. I think just GHK copper, you can experience a glow. But if you add in the BPC and the TB500, that all together is going to work on like skin healing, wound healing, and then tissue repair plus the glow effect of the GHK copper. So it's very good for.
Because that the GHK copper, that is the big aesthetic one that people are like craving about how it's making their skin and their hairs and their nails. What is the mechanism of action that's causing that?
It's actually going in like I think copper, I think a lot of people are low in copper, which is helping collagen production, telomere lengthening. And so it's very anti-aging. And I just feel like, I put my mom on it, for example, and she's 60, and people are literally walking up to her and like, what are you doing? Like, it is noticeably like glowing. And I don't like it just for a vain purpose. It's actually very deeply healing to the connective tissue. When I talk about hypermobility, which a lot of people are dealing with post COVID, with soreness and just inability to work out, once you bring in that, you can have better recovery benefits. So that's an amazing one. And then my last one that I want to mention that I just absolutely love, when it's in the pharmacies, it's CJC ipamorelin, or if not, samorelin is a backup for women, and then for men, the tesamorelin ipamorelin blend. So this is going to increase growth hormone naturally in the body instead of taking exogenous growth hormone. Um, a lot of people with autoimmune or in environmental toxins, and you're inhaling it, it actually goes and affects the brain, and that's where growth hormone is actually produced by the pituitary to release. So when I was going through mold, I actually lost a lot of muscle. And one thing, my very first peptide I ever tried was the CJC 1295 with ipamorelin. And within 3 days, I was like throwing around my huge soil bags when I was gardening, and I wasn't getting sore. And I was like, okay, now I'm actually gaining muscle. And I got like a 6-pack without working out. And I was like, what am I taking? I didn't know what peptide therapy really was. Like, I was like, okay,
Mhm.
I'm listening now. This is crazy. And so if you want to take recovery to the next level, you can cycle that for about 3 months. But I do recommend taking a break from that because you don't want to tire your pituitary out and produce the growth hormone too much. And so that's actually one of my favorites. It's got anti-aging effect too. When you do that, it increases cell turnover, so you actually get new skin. And I noticed like it have like as much wrinkles, and I just felt like it was a very vain peptide as well. People were like, what are you taking? And so I do love that one. That's definitely in my top 5. It's the growth hormone secretagogues. Um,
Yeah.
and men are loving the testosterone. It's more, I think, a power punch for men, and like they're losing abdominal fat, but they're gaining so much muscle. In women, they're retaining water a little too much on the testosterone, so I like to kind of leave that one for the men. But women can take it as well if they're really wanting to put on muscle.
Yeah, no, we have experience with both. We lean heavy towards the Tessa with more people just because of the higher, growth hormone stimulation, and the visceral fat, right? Obviously, the visceral fat is going to be the hardest to get, and obviously um, the not as great for you as subcutaneous, right? Subcutaneous is a little bit easier to burn off, but that stubborn belly fat, to your point, where men are going to have a lot more of that. It just has a stronger, to your point, a stronger punch when it comes to the metabolic impact. But both are great, right? They're both stimulating growth hormone, which is huge for recovery. It's huge for sleep. It's huge for metabolic health overall. But yeah, it definitely that Tessa, Moreland, and Ipamorelin definitely have a much stronger punch. So those are your top 3. So GLP, GIPs, BPC, TB500, GHK, copper, and then Tessa and or CJC and IPA. Tessa and IPA. What other ones do you have experienced that might not necessarily be for everybody, but in certain use cases, like some of the cognitive um, peptides? What about those?
So there's ones called CMAX and C-Link. They're often blended together, but I feel like these aren't talked about enough. But I have some customers that are just really struggling with focus or the neuroinflammation. And the Solange I like to describe as more of a calmer effect. It's like, I feel like it's like the feeling of having a cocktail without the negative benefits of a cocktail. It's actually just calming you, it's making you relax, making you not think about all the worries of the day. And then the CMAX is more of a focused peptide, especially people who are trying to work with like maybe less stimulants, or they're not taking stimulants, struggle with focus. CMAX is going to be great. I do have um, some entrepreneurs on that who are like loving that one, who are just like, okay, now I can get way more done in the day. If there is there any other cognitive ones that you guys are using besides those?
Those are, I mean, there's like the those are the two that we really focus on, just because of more use cases. There's other ones out there like dihexa or DSIP that I know people talk about, but the ones that we really like are C-Lank and C-Max. To your point, right? The C-Lank for calm people who have chronic stress or anxiety, people who have high pressure jobs, or high functioning professionals with high pressure jobs, helping with nervous system regulation. CMAX, enhancing BDNF, improves focus, learning, and it really does, give you that laser focus that a lot of people like. But in terms of like products that we're just using for cognitive enhancement, those are the two that we focus on. I mean, obviously you get some out of you get cognitive enhancement from the GLPs, GIPs, and the other ones that we mentioned, as secondary benefit. But in terms of directly for cognitive, those are the two that we really focus on.
What would you say are the top performing peptides at your guys' clinic?
BPC 157, whether it's the combo with TB 500 or not, that's definitely number one. Uh, Closely right behind that, like I said, is the Tessa and IPA. People are really craving about that. Obviously, GLPs, GIPs are number one, right? That's not considering those. So BPC, Tessa, and IPA, um, those two clearly take the lead. And then there's some that mix in there. MOTS-C, IGF, IGF 1 LR3. I see a lot of more so men using that with a Tessa and IPA for muscle growth. And Obviously we have GHK copper, but obviously that leans more towards the aesthetic and women's side for us, than men. But the two that are clearly ahead behind GLPs are the BPC and IPA and Tessa and IPA.
Yeah, the GHK copper I forgot to mention is also great for like follicle hair, so hair growth. And a lot of people on GLP-1s, especially if they're on too high of a dose or they have autoimmune issues and they're losing hair, you can use GHK copper.
No, I mean, I think, like I said in the beginning, I think peptides, this is going to be a year of the peptides. I think they're going to be transformative when it comes to how we talk and speak about um, longevity and anti-aging and functional medicine. Because peptides they're not shortcuts, right? They're chains of amino acids. They're precision-based tools when used correctly. They can really help us restore communication, accelerate healing. I think the sky's the limit for them, and hopefully, pretty soon, the FDA takes them out of class two, so that more of the compounding pharmacies, because that's another thing that we didn't really talk about that probably should take some time. It's just how to source, right, peptides, right? It's the wild wild west, right? And um, finding a pharmacy or a supplier that you can be very reliant on. Again, just everyone's popping up stores left and right. And I think it's extremely important to make sure that you're going with someone that you trust, right? Did the proper vetting of the pharmacy or the pharmacy that they're getting it from, making sure that it's US based and US sourced, making sure that they're following, because, there's a lot of words and information about don't use research only peptides, right? Well, I think you can't just say that, right? Because there are some pharmacies that are following compliance guidelines that yes, they might not be a 503A, 503B, but they're following all the same guidelines, right? They're producing it in clean rooms the proper way, doing the third party batch testing to make sure that it hasn't been compromised. So talk to us about what are some of the steps that people can take to make sure that if they are going down to try these peptides, that they're not getting it from the black market or somewhere in from China or wherever.
So when people come to work with me, it's because they trust me and the sources that I've sourced. So my my first preference is 503A pharmacies. I've noticed just like they're better quality and they produce better results. I also love working with these pharmacies with clients because they come already mixed in a sterile environment and they're shipped to the client's door with their dose on it. So like ease of use is there for a lot of my people who are overwhelmed and just, have looked at the, maybe the research industry and been overwhelmed by it and they're scared and they just don't want to go down that route. Then I have, especially if I'm working one-to-one with somebody who needs something like KPV or they need SS31 and I can't get it from a 503A. I did find, you have to be a provider to work with the company, but it's professional grade. I feel like what you mentioned, it's not research where you don't know what is going on, what lab they're doing. If they keep running COAs, it's not a guess. It's really good in quality and it's considered professional use. So I feel like that's the step in between. And so sometimes I'll use that. And I do use exosomes from that company as well. And I've had really great benefits with exosomes, which will probably be more of a hot topic in 2027. But I will use that when needed, but I usually don't use that because the client still has to mix them themselves and it's just overwhelming and most people don't want to do that. So I work with two different 503A pharmacies that I trust. I work with a provider who will prescribe and oversee. You have to submit your labs to us. It's just, we're there for you every step of the way. So I usually help people also decide what direction to go if they're like between two things. We also didn't talk about other things like glutathione and NAD, which is pretty popular. And so we do offer things like that. And sometimes it's just confusing where to start and who to source from. So it's really just important to work with someone that you trust who's been down that journey. You guys have great clinics too. And I know your people trust you and they're getting the results that they want.
Yeah. No, look, it's you know, this type of medicine in the future, we're just scratching the surface. The more people that are talking about it, the better. The more the word that gets out, the more people can find and seek the information and the answers that you were looking for. Like my mom was looking for when back before we even founded Nava. The reason why we founded Nava. Um, so it's amazing and just super enjoyable to be able to talk about other passionate individuals. Um, so I know you're working on some exciting things. So what let us know a little bit more about the information that some of these exciting things that you have coming up in the future.
Yeah, so first, if you're not following me, I share a lot of biohacking on my Instagram. It's called the Biohacking Nurse. And I love sharing my autoimmune journey, peptides. I'll share about skin health and anti-aging longevity, which I've been really interested in, especially when you go through autoimmune disease, you can age much quicker. And so I'll share a lot there and share resources. The next thing on my Instagram is you can go download my free peptide guide to get my top 3, and then that will tell you where to order and how to work with me. I do offer consults once a month, especially if you just don't know where to start and you want a 1 hour consult with me to sit down and really go through your goals. And then in May, I'm actually doing my first ever biohacking retreat that I'm hosting in Carlsbad, California at the Selah Center. I got to go. One of my friends and mentors, Christine Schaffner, actually is a co-founder, and she used Swiss, German medicine. She's used the best of the best to create a healing center. So we're going to work on nervous system regulation with the shift wave and other modalities. I'm going to teach a peptide class while we're there to try to help you figure out your goals and how to make stacks throughout your year. And then there's going to be opportunities to do IV therapy, exosomes. We'll have CO2 lymphatic suit that like drain my lymphatic system. I mean, there's just going to be so much opportunity to heal in a matter of 3 days. And then you're going to get an experience where you can take that information and go and improve your health, whether you're working with a physician or you aren't. And so that's going to be on my Instagram information as well to apply for the retreat.
No, that's awesome. It's like I said, just having events like that and just bringing more people together that can help educate, can help spread the word. Really make that type of impact. That's, to me, that's part of the reason why I have this podcast. Right, it's that legacy part that just it's changing culture. It's shifting the narrative. It's super exciting. So yeah, definitely need to keep up with when that's going to be. You said out in California?
Yeah, in Carlsbad. It's beautiful. Like you can see the ocean from the healing rooms.
Yeah. Wow. All right. Well, so we'll keep on the lookout for that. Before we wrap up, just have a few other questions. Is there any other things that you want to share that you're working on?
That's just kind of where I'm at right now. I'm sure there'll be more in 2026. I have so many things I want to do. It's just the matter of the time and the energy to do them, and then balancing my own health. So I will announce everything through Instagram, and that's where you can access working with me.
Awesome. Well, yeah, no, definitely got to give her a follow. Before we wrap this up, just have a few questions I'd like to end with. First one's being, what is the best advice you've ever received?
I really love this quote. It's make a decision and make it right, because when you feel like you're an autoimmune disease and you don't know where to go and what to do, sometimes you just have to make a decision, and then you have to make it right, where you're like, hey, I'm going to try this out. I'm going to give myself the benefit of the doubt. And if it's not right, you make another decision, and it helps you move through the stuckness of what autoimmune is really, and it helps you get your power back.
No, I love that. Then the next one's, what's the biggest problem that you're trying to solve right now?
Biggest problem trying to solve is definitely consistency with like my focus and my energy. Sometimes I like overexert, and then I find myself, retracting and try to gain energy. So I'm trying to work on daily routines where I'm waking up at the same time for circadian rhythm. I'm doing like some sort of vagus nerve tools for my mental health and my nervous system before I'm getting on my phone. I'm trying to eat enough protein focused meals in the morning to balance my blood sugars. And then also there's always improvement to make. I still work with a physician. I'm still working on environmental toxins. And sometimes I'm like, I want to be over this. I want to solve this already. I want to be done with the toxins. But like it's an ongoing journey, and it's a mindset shift of like, this is just, you're lucky to be on this journey, because you always have an opportunity to get better. And if you're in that state, a much better state than being like, in an autoimmune journey where you're like, I'm out of resources, I don't know what else to do. It's just to pace myself and continue this journey, because there always are improvements to be made. And there's also like that consistency to be kept.
No, I mean, I think, look, it's, you got to take the time to take care of yourself, right? You got to make sure that you're nourished. You got to make sure that you're hydrated. You got to make sure that You get that quality sleep, right? You're not resting, um, you know, just to rest. You know, you're resting so that you can keep going, right? So you can keep going hard. So it's not a weakness when you have to rest, right? You just have to, again, it's the mindset shift, right? You are resting for a reason. It's intentional. You are resting so that tomorrow you have that energy to get back after it. So I think that's huge. And again, just really taking care of yourself and listening to your body. Last one before we close this out is, when it's all said and done, what do you want your legacy to be?
I think that, legacy started with my dad, who passed away when I was 17, and I lost him to a mental health battle. And my legacy is just to continue to share my own struggles and my own triumphs to as many people as I can, and bring forward the best resources so that people just feel empowered to be like, hey, there, I can get better, I can improve, this isn't the end. And I never want people to feel like this is the end, like my dad felt like. And, if they can walk away with that, I would just be so grateful. And, he's just a huge inspiration to my journey and the legacy that I want to live.
No, that's awesome. I love that. Well, Cheyenne, I really appreciate you taking the time to come on to the show. Your story resonates with me, but not just me, but so many others, right? And I think the big taking from this is, it's not that you really are anti-medicine or like left medicine, right? It's really, you just became pro-truth. Like, you saw a better way, right? You saw a way to get deeper into healthcare, to really make an impact, and to leave that legacy. So I appreciate you sharing your journey. It just reinforces something that we talk about often on the show, right? The longevity doesn't just come from prescriptions, right? It comes from asking better questions, understanding symptoms or systems, and having the courage to admit, when a model is incomplete, and for you to go, elsewhere and find the answers like you did, right? How you solved, a lot of your own issues, your own autoimmunity. So again, thank you, for bringing your story, your message, and I appreciate you having on the show.
Thanks for having me, Zach.
If today's conversation sparked something in you, here's what I want you to do right now. Pick one strategy, one insight, one small action you heard today, and commit to it this week. Excellence isn't built in moments. It's built in the daily decisions that compound over time. Remember, you're not just building a healthier body or a more successful career. You're building a legacy that will outlast you. And that starts with the standards you set today. Thanks for listening to the Legacy and Longevity Podcast. If this episode was valuable, first subscribe so you never miss an episode. Then leave us a review to help more people find these conversations. And finally, share it with someone who you think needs to hear it. Until next Tuesday, keep raising the bar, keep pushing your limits, and keep stacking days. I'm Zach Dancel. Your legacy starts now.